I'm Dr. Manish Bhatia. I'm a practicing homeopath and I practice at Asha Homeopathy in Jaipur. I'm also an associate professor at Swasthkalyan Homeopathic Medical College in Jaipur. I'm the director of hpathy.com, which is the world's largest homeopathic medical portal. I'm also an editor of Homeopathy for Everyone, which is again the world's leading homeopathy journal. And I'm an author and my books are part of the curriculum worldwide. And that's about it. The problems start very early on, even before a person becomes a doctor. Because what happens is that most people have an idea that being a doctor is a very glamorous and very profitable job, but that's not right. Because what happens is that medical profession, although being a noble profession, but it needs a lot of time and effort for a doctor to mature. And most of the time, by the time a doctor becomes an MD or DM or MCH, they are already in their early 30s. So what happens is financially most of the doctors starting very late compared to other professions like a CA or an engineer or a businessman. They are already 10 years behind financially. So that is a huge gap. We are all studying for nearly 10-12 years to get our post-graduation and super specializations, and then we are starting late financially. And then what happens is that we are busy building our careers for the next 10 years. During the time, most of the other people, they are consolidating their growth in their 30s and 40s. They are maturing, and what we are doing is we are taking baby steps. We have just started earning. So that creates a problem. By the time we are financially stable, we are already in our 40s. Because if you look at the numbers, hard numbers, there are around 70,000 MBBS seats in India every year. 67,000, 70,000 around. There are only around 25,000 MD seats. So what that means is around 45,000 doctors per year cannot even do post-graduation. And for these 70,000 people, there are only 2,000 super specialization seats in India. So they are beginning late. And when they begin late, you being a financial advisor, you people know that they lose on the power of compounding. Somebody who starts taking care of the financial goals at say at 25, 26, 27, and somebody who starts at 37 or 40, it's going to make a huge difference. It would be nearly impossible for the doctor to catch up with an engineer who starts at 25. What I personally feel is that most of the doctors are not financially literate. They're more into their practice. They come with some noble goals. Unless and until you are in a big corporate hospital, or you have got a very successful practice, which again is like 5% of the doctors. For the 95%, by the time they realize they need financial planning, they need financial goals, they have already a lot of financial expenses on their head. Because by the time a person is around 42, they already have first child who is in 10th, 11th. So the expenses for the children are going to mount now. And the children are going to get for their college education, then they are going to go for marriages. So as the doctor starts earning, so the expenses also start shooting at around the same time. So without a proper financial planning, without proper financial goals, without proper asset management, what I see is that most doctors do not do phenomenally well. Usually it is somebody in the family. कोई भाई, कोई मामा, कोई चाचा, कोई किसी का बेटा, किसी की बेटी जो कि बैंक में है, जो कि कोई किसी इंश्योरेंस कंपनी में है, या कोई आपका पेशेंट. अगेन पेशेंट्स आर अ बिग सोर्स ऑफ इंफॉर्मेशन, और दे डॉक्टर्स रिलाई ऑन देयर गुड पेशेंट्स कि अच्छा आप बहुत अच्छा ये काम करते हो तो हमारे को भी बता दो हम कहाँ पैसा लगाएं. So doctors need to realize as a patient has his due diligence when they select a doctor. आपको एक मरीज को डॉक्टर चाहिए होता है तो फेसबुक पे भी जाके पूछेगा, वो जस्ट डायल पे भी देखेगा, वो गूगल पे रिव्यूज़ भी देखेगा, और फिर वो पर्सनल रेफरेंसेस भी लेगा, और फिर वो बेस्ट डॉक्टर के पास जाना चाहता है. तो एक डॉक्टर को जब अपनी फाइनेंशियल हेल्थ के लिए एडवाइस चाहिए तो वो ऐसे किसी पे भी भरोसा कैसे कर लेता है. उसे क्या ये नहीं होना चाहिए कि उसे अपनी फाइनेंशियल हेल्थ के लिए बेस्ट एक्सपर्ट्स के पास जाना चाहिए? बैंकर को आप बहुत ट्रस्ट करते हो, जिस रिलेशनशिप मैनेजर को आप बहुत ट्रस्ट करते हो बैंक में, वो बेसिकली दे आर लाइक कॉर्पोरेट हॉस्पिटल्स। बैंक्स आर लाइक कॉर्पोरेट हॉस्पिटल्स। जैसे कॉर्पोरेट हॉस्पिटल में हॉस्पिटल का जो एडमिनिस्ट्रेशन होता है उसको मरीज से मतलब नहीं होता, उसका टर्नओवर के टारगेट्स होते हैं, उसको हर डिपार्टमेंट की प्रॉफिटेबिलिटी देखनी होती है, हर डॉक्टर की प्रॉफिटेबिलिटी देखनी होती है। वैसे ही बैंक्स में भी हर बैंक के अपने टारगेट्स होते हैं, हर महीने के टारगेट्स होते हैं। एक महीने में उनको पॉलिसीज बेचनी है, दूसरे महीने में म्यूचुअल फंड्स बेच रहे हैं, तीसरे महीने में ये प्रोडक्ट्स बेचना है। और वो किसको बेचेंगे? अपने कस्टमर्स को। Not because the customer wants those products or not because the products are good for the customers, but because they have a monthly target to meet. Financial advisory itself is a profession. Not anybody, your banker is not your financial advisor. Even your chartered accountant is not your financial advisor. A financial advisor is a separate profession. There are two things. One, there are a lot of doctors who really want to work, and that's a good thing. But there are a lot of doctors who need to work because they need that financial inflow. So if a doctor has a handsome corpus, retirement corpus, and if they are able to meet their financial goals, then probably some of them would like to retire and lead a more peaceful life. This is what I believe that doctors need. Because doctors don't have time to monitor their investments. Most of the doctors don't. So it is necessary that somebody takes care of that monitoring for them. Okay, if this particular product is not working, then let's change the portfolio distribution. If that is not done, then what I feel is a lot of doctors get stuck with bad investments.